You wake up thinking you're starting your day right. Maybe you skip breakfast, reach for coffee, or rush out the door. But what if these small, everyday choices are quietly forcing your blood pressure to climb before you've even checked your phone? The truth is, your morning sets the tone for your entire cardiovascular system. Right after waking, your body experiences a natural cortisol surge, blood vessels tighten, and your heart works harder to get oxygen flowing. Add the wrong habits, and that normal rise turns into a silent, dangerous spike. In this video, you'll discover 6 doctor-approved explanations behind common morning routines that unknowingly raise your blood pressure and learn simple fixes to keep your heart protected from the moment you wake up. Disclaimer: this video is for educational purposes only and not medical advice. Skipping breakfast, the hidden morning stressor that spikes blood pressure. You might think skipping breakfast helps you stay slim or save time, but your heart disagrees. Skipping that first meal doesn't just make you hungry. It can quietly send your blood pressure soaring before noon. After a night of fasting, your body's blood sugar and energy levels are already low. When you skip breakfast, your system stays in survival mode. Your adrenal glands release stress hormones, especially cortisol and adrenaline, to keep your energy up. These hormones constrict your arteries and make your heart beat faster, leading to a temporary but dangerous rise in blood pressure. Over time, this habit increases your risk of developing chronic hypertension, especially in people over 40. What's happening inside your body? During sleep, your blood pressure naturally drops, a process known as nocturnal dipping. But when you wake up, your body triggers a cortisol surge to get your organs active again. This morning surge is completely normal unless you skip breakfast. Without nutrition, your body keeps pumping cortisol to maintain blood sugar levels. The result? Persistent vessel constriction, higher heart rate, and thicker blood viscosity. Think of it like trying to drive a car without fuel. Your engine has to work harder, overheating in the process. Your heart is that engine. Dr. Insight's studies from the American Journal of Hypertension show that people who skip breakfast are up to 30% more likely to develop high blood pressure compared to those who eat a balanced morning meal. Cardiologists explain that eating breakfast helps signal your body that it's safe to relax. When nutrients like complex carbohydrates, fiber, and healthy fats enter your system, insulin and serotonin are released, calming the nervous system and lowering stress hormone activity. Real-world example. Imagine a busy morning. You wake up late, skip breakfast, drink coffee, and rush into traffic. Your stomach is empty, but your bloodstream is full of stress chemicals. You feel jittery and impatient. Your blood pressure is already climbing. Compare that to someone who takes 5 minutes for a simple oatmeal bowl or smoothie with banana and flaxseed. Their glucose levels rise gently, cortisol stays balanced, and their arteries stay relaxed. How to fix it safely: eat within 60 minutes of waking up to balance your morning hormones. Focus on potassium-rich foods like banana, avocado, or yogurt that help neutralize sodium. Add protein and fiber, such as oats, eggs, or chia seeds, to sustain energy and reduce cravings. Avoid sugary cereals or pastries, which cause blood sugar spikes followed by sharp drops, another stress trigger for your heart. If you're not hungry early, try a light smoothie or fruit bowl. Small nutrition is still better than none. Curiosity hook. Did you know people who eat breakfast regularly tend to have lower average heart rates throughout the day? Proof that your first meal sets your cardiovascular rhythm. Skipping breakfast might save time, but it costs your heart peace. Feed your body early, and you'll keep those morning blood pressure surges in check. The coffee trap. How your morning brew secretly raises blood pressure. That first cup of coffee feels like the ultimate morning ritual. Warm, comforting, energizing. But here's the twist. While your mind wakes up, your arteries might be tightening. Caffeine stimulates the central nervous system, giving you alertness and focus. However, it also triggers the release of adrenaline and norepinephrine, the same stress hormones that raise blood pressure and heart rate. For most people, this effect is mild and short-lived. But if you already have high blood pressure, drink coffee on an empty stomach, or are highly sensitive to caffeine, your blood pressure can spike by 10 to 15 millimeters of mercury within 30 minutes of that first sip. Over time, These morning surges may damage arterial walls and increase the risk of heart strain. What's happening inside your body? When caffeine enters your bloodstream, it blocks a natural compound called adenosine, the chemical that helps your blood vessels relax and promotes restful sleep. Blocking adenosine means your arteries stay slightly constricted and your heart must pump harder. At the same time, caffeine stimulates the adrenal glands to produce cortisol, increasing both systolic and diastolic pressure. Combine that with the body's normal morning cortisol surge, and you get a double hit: more stress hormones, higher blood pressure, and tighter arteries. The effect is strongest if you drink coffee before eating or before your body has rehydrated. Dr. Insight. According to research from the American Journal of Clinical Nutrition, caffeine raises blood pressure in about 80% of hypertensive adults, especially during the first few hours after consumption. Cardiologists recommend limiting caffeine to no more than 200 milligrams per day, roughly 2 small cups of coffee, and always pairing it with hydration and food. Dr. Michael Blaha, a preventive cardiologist at Johns Hopkins, explains, coffee isn't the enemy, it's about timing and balance. Drink it after breakfast, not before, and never substitute it for water. Real-world example: you wake up, skip breakfast, pour a strong coffee, and scroll through your phone. Within 15 minutes, you feel alert, but your blood pressure monitor might tell a different story: 150/92 instead of your usual 130/85. Add another cup mid-morning, and your arteries stay tense for hours. Now imagine having that same cup after breakfast and a glass of water. Your blood sugar is stable, cortisol is already tapering down, and caffeine's impact becomes much gentler. How to fix it safely? Always drink a glass of water before your first coffee to counter dehydration. Wait 30 to 45 minutes after eating before consuming caffeine. Choose medium roast coffee, lower caffeine than dark roasts. Avoid adding excess sugar or creamers. These can further increase vascular inflammation. Consider alternatives like green tea or decaf if you notice dizziness or palpitations. Curiosity hook. Did you know that caffeine's blood pressure raising effect lasts longer in people with a specific gene variant called CYP1A2? These slow metabolizers feel jittery for hours and are more prone to hypertension from coffee. Your morning coffee isn't bad, it's just powerful. Use it wisely and it can energize you without putting your heart under pressure. Morning rush and stress, the adrenaline spike that pushes your blood pressure up. Running late, stuck in traffic, multitasking before breakfast. Sound familiar? These rushed mornings may feel normal, but inside your body, they're like pressing a gas pedal on your heart before the engine even warms up. When you wake up, your body naturally produces cortisol and adrenaline to help you transition from rest to activity. But when you add emotional stress, like rushing, skipping meals, or checking a flood of notifications, you multiply those hormones dramatically. That surge doesn't just make you feel anxious. It tightens blood vessels, raises heart rate, and sends blood pressure soaring. Repeated morning stress spikes are one reason why heart attacks and strokes are most common between 6 a.m. and 10 a.m. What's happening inside your body? In moments of stress, your sympathetic nervous system, the fight or flight system, takes charge. Adrenaline floods your bloodstream, causing your heart to beat faster and your blood vessels to constrict. Meanwhile, cortisol keeps your body on high alert, increasing glucose levels for energy. When this happens repeatedly every morning, your arteries lose flexibility, your heart muscle thickens, and inflammation rises inside your vessel walls. This daily hormonal storm silently ages your cardiovascular system, even if your blood pressure returns to normal later in the day. It's not just the stress itself, it's the timing. The morning is when your body's natural blood pressure rhythm, called the morning surge, is already at its highest. Adding emotional tension amplifies the effect dramatically. Dr. Insight, cardiologists often see this pattern in patients with morning hypertension. Dr. Sheldon Sheps from the Mayo Clinic notes that people who start their day under pressure, rushing, skipping hydration, or worrying early show elevated systolic readings even before breakfast. Long-term, these micro spikes increase risk for stroke, heart attack, and aneurysm formation. That's why many doctors now encourage patients to adopt a slow start routine. Just 5 calm minutes after waking, before screens or chores, can reduce stress hormones by up to 20%. Real-world example. You wake up, realize you're late, rush to shower, skip food, grab your keys, and jump into traffic. You feel your chest tightening, your mind racing, and maybe a light throbbing behind your temples. That's your cardiovascular system under full adrenaline control. Now imagine starting your day 5 minutes slower, breathing deeply, stretching, drinking water, and setting small priorities instead of reacting instantly. You'd notice the difference not just in your mood, but in your blood pressure readings. How to fix it safely. Wake up 15 minutes earlier to give your body time to transition from rest. Avoid checking emails, news, or social media right after waking. Start your morning with slow, deep breathing or gentle stretching. Prepare essentials the night before to reduce morning decisions. If driving, listen to calming music or guided breathing instead of stressful news. Curiosity hook. Here's a surprising fact. A study in the Journal of Hypertension found that people who started their day calmly had lower 24-hour blood pressure averages, even if they faced stressful jobs later. Your morning mood sets your blood pressure rhythm for the day. Slow down your start, and your heart will thank you every hour that follows. Dehydration, the silent morning trigger that tightens your arteries. Most people start their mornings with coffee, but almost no water. What they don't realize is that this simple mistake silently makes their blood thicker, their arteries tighter, and their heart work overtime. Before the day has even begun, when you wake up, your body is naturally dehydrated. You've gone 6 to 8 hours without fluids, yet you've lost water through breathing, sweat, and urine. Even mild dehydration, just 1 to 2% of body weight, causes your blood vessels to constrict and your blood volume to drop. Your heart compensates by pumping faster, raising your blood pressure to maintain circulation. Over time, this morning dehydration habit can contribute to chronic hypertension, dizziness, or even irregular heartbeat in older adults. What's happening inside your body? Your blood is made up mostly of water, about 90%. When water levels fall, blood becomes slightly more viscous, meaning it moves less freely through your arteries. This increases resistance and forces your heart to push harder to deliver oxygen. Your kidneys also sense this change and release hormones like vasopressin and angiotensin II, which cause your blood vessels to tighten and retain sodium and water. It's your body's emergency attempt to conserve fluid, but it also spikes blood pressure temporarily. Drinking water in the morning reverses this chain reaction almost immediately. As you rehydrate, your kidneys reduce vasopressin, your blood thins, and your arteries relax, lowering pressure naturally within minutes. Dr. Insight. According to a study published in Clinical and Experimental Pharmacology and Physiology, drinking just 500 milliliters, about 2 cups, of water can increase sympathetic nervous activity briefly, but then results in sustained improvement in vascular elasticity and heart rate variability. In simple terms, your body stabilizes faster when hydrated early. Cardiologists often advise patients to waterload before caffeine or breakfast. Dr. Naomi Fisher from Harvard Medical School notes, a glass of water before coffee helps offset caffeine's diuretic effect and supports smoother cardiovascular function. Real-world example, you wake up, rush to make coffee, skip water, and head to work. By mid-morning, you feel lightheaded or tense, and your blood pressure reads 145/90. It's not stress or caffeine alone, it's dehydration amplifying everything. Now picture this alternative. Before coffee, you drink 2 glasses of room temperature water. Within 10 to 15 minutes, your pulse steadies, your energy lifts, and your reading drops closer to 125/80. It's the simplest morning fix your heart could ask for. How to fix it safely. Drink 1 to 2 glasses of water immediately after waking, before coffee or tea. Use room temperature or slightly warm water for faster absorption. Add a slice of lemon or a pinch of electrolyte salt for extra hydration. Avoid starting the day with sugary juices. They spike insulin and dehydrate later. Keep a water bottle near your bed as a visual reminder to hydrate first thing. Curiosity hook. Here's something surprising. People who drink water within 30 minutes of waking have significantly lower morning blood pressure surges and better kidney function than those who wait until mid-morning. Your morning heart health starts with a single glass of water. Rehydration restores balance, thins your blood, and gives your arteries the flexibility they need to face the day. Too much salt in breakfast, the sneaky sodium surge that raises your morning BP. That healthy breakfast you trust, toast, eggs, maybe cereal or a sandwich, might be quietly loading your body with more sodium than you'd get from a bag of chips. And for your blood pressure, that's like starting the day with a ticking time bomb. Sodium is essential for nerve and muscle function, but too much of it disrupts the delicate fluid balance in your bloodstream. When sodium levels rise, your body holds on to water to dilute it. The result? Higher blood volume, tighter arteries, and elevated blood pressure. Morning meals loaded with processed or packaged foods like bread, cheese, sausages, instant soups, and even some healthy cereals can deliver your entire day's sodium allowance before 9 a.m. What's happening inside your body? Here's the biology. Sodium attracts and retains water inside your blood vessels. This added fluid volume increases the pressure on arterial walls, forcing your heart to pump harder. At the same time, excessive sodium reduces the production of nitric oxide, a molecule that keeps arteries flexible. Without enough nitric oxide, your vessels become stiff, circulation slows, and your blood pressure rises further. The problem is worse in the morning because your kidneys are still balancing electrolytes from the night before. Eating a high-sodium breakfast during this period overwhelms them, leading to fluid retention that can persist throughout the day. Dr. Insight cardiologists consistently warn that morning sodium surges are among the most dangerous for people with hypertension. A study in the Journal of the American College of Cardiology found that adults who consumed high-sodium breakfasts experienced an 8 to 12 millimeter of mercury increase in systolic blood pressure lasting up to 6 hours. Dr. Frank Sachs from Harvard's T.H. Chan School of Public Health explains, your arteries are least prepared for salt overload in the morning. That's when vascular stiffness is naturally higher. He and other experts recommend starting your day with low-sodium, potassium-rich foods, which help offset sodium's harmful effects. Real-world example. You grab a quick breakfast, buttered toast, cheese omelet, and a slice of ham. Harmless, right? That combination can easily pack over 1,000 milligrams of sodium, half your daily limit. Add coffee and little hydration, and your blood pressure can spike 10 to 15 points before lunchtime. Compare that to a breakfast of oatmeal topped with banana slices, a handful of nuts, and low-fat yogurt. You'll stay full, energized, and your blood vessels will stay relaxed. How to fix it safely? Read labels. Even healthy cereals and breads can be sodium traps. Replace processed meats with fresh eggs, beans, or avocado. Use herbs and spices like turmeric, basil, or garlic instead of salt for flavor. Include potassium-rich foods like fruits and leafy greens to balance sodium. Limit total sodium intake to 1,500 to 2,000 milligrams daily, especially if you're over 40 or hypertensive. Curiosity hook. Did you know? Just 1 teaspoon of table salt contains 2,300 milligrams of sodium, more than the entire daily recommendation for a healthy adult. Your breakfast can either calm your arteries or constrict them. Skip the salt overload, and you'll keep your morning blood pressure where it belongs, steady and safe. Lack of morning movement, why staying still after waking, keeps your BP high. You wake up, grab your phone, and spend the first 30 minutes scrolling or planning your day without realizing your blood pressure is quietly climbing. The longer you stay still after waking, the more pressure builds inside your arteries. When you sleep, blood circulation slows and your muscles rest. Upon waking, your cardiovascular system needs to restart. Your heart must pump more efficiently, and your blood vessels must expand to meet the day's demand for oxygen. If you stay inactive, blood flow remains sluggish, and your arteries remain constricted. Over time, this morning stagnation can contribute to poor vascular flexibility, fluid retention, and higher resting blood pressure. For seniors, this also increases the risk of dizziness, edema, and even morning stroke. What's happening inside your body? In the morning, your heart rate and blood pressure naturally rise to prepare your body for movement. But if you remain still, this transition is incomplete. The result? Your venous return, the flow of blood back to your heart, remains weak. The body compensates by tightening arteries and releasing stress hormones like norepinephrine to push circulation along. This artificial pressure increase can make your blood vessels more rigid over time. Gentle motion, on the other hand, activates your muscle pump mechanism, tiny contractions in your legs and core that help move blood upward. This improves oxygen delivery, reduces stiffness, and lowers both systolic and diastolic readings naturally. Dr. Insights, a study in the Hypertension Research Journal found that people who perform just 5 minutes of light morning activity, like stretching or slow walking, experienced up to 7 millimeters of mercury, lower systolic blood pressure compared to those who stayed seated after waking. Cardiologists emphasize that this isn't about exercise intensity, but consistency. Dr. Suzanne Steinbaum, a preventive cardiologist, says, "Your heart doesn't need a gym membership, it just needs movement. Gentle motion in the morning acts like a warm-up for your arteries." Real-world example. Think of two people. One wakes up and immediately checks their phone, sitting for 45 minutes before showering. The other spends the same time doing light stretches, walking to the kitchen for water, and practicing a few deep breaths. The second person's heart rate increases slightly, blood vessels expand, and blood pressure stabilizes faster. Meanwhile, the sedentary one experiences higher stiffness and sluggish blood flow for most of the morning. How to fix it safely? Start with gentle bed stretches, ankle circles, arm raises, neck rolls. After getting up, walk for 3 to 5 minutes, even around your home. Combine with deep breathing to oxygenate your blood. Seniors or those with balance issues can use chair exercises for safety. Avoid jumping directly into intense workouts before warming up. Sudden exertion can cause pressure spikes. Curiosity. Did you know? Just standing up after waking improves circulation enough to raise nitric oxide levels, your body's natural artery relaxer, within minutes. Your first few minutes after waking decide how your heart behaves for the rest of the day. Move gently, breathe deeply, and remind your circulation that the day has begun on your terms, not stresses. Doctor-approved morning routine to keep your blood pressure stable all day. Imagine starting your day in a way that keeps your heart calm, your arteries open, and your blood pressure balanced, all before you even leave your bedroom. This isn't wishful thinking. It's the power of a doctor-approved morning routine designed to support your cardiovascular system from the moment you wake up. Morning is the most vulnerable time for people with high blood pressure. Your body experiences its highest natural cortisol and adrenaline surge right after waking, a process meant to prepare you for the day. But if you pair that biological stress with poor habits, like skipping breakfast, staying dehydrated, or rushing through tasks, you push your heart into overdrive before it's ready. The right sequence of small, gentle actions can flip that stress response and train your blood vessels to stay flexible, relaxed, and resilient throughout the day. Step 1. Hydrate before anything else. Start your morning by drinking 2 glasses of room temperature water, even before you reach for coffee or your phone. Overnight, your body loses fluids through breathing and sweating, leaving your blood thicker and your arteries stiffer. Water replenishes lost volume, helps the kidneys flush out sodium, and restores circulation. Think of it as turning on your body's internal pump with clean fuel instead of caffeine. Doctor's tip: add a slice of lemon or a few drops of electrolyte solution to enhance absorption. This gentle hydration can lower systolic blood pressure by 5 to 10 points in the first hour of your day. Step 2. Move gently, breathe deeply. After hydration, spend 3 to 5 minutes in light motion. Stretch, roll your shoulders, flex your ankles, or take a short walk around the room. This activates the muscle pump mechanism, which pushes stagnant blood from your legs back toward your heart. Pair the movement with deep, slow breathing. Inhale for 5 seconds, exhale for 6. This activates the vagus nerve, calming your nervous system and encouraging your blood vessels to relax. Doctor's tip: even people with limited mobility can perform simple chair stretches or breathing exercises. The key is rhythmic, gentle motion. Step 3. Eat smart, eat early. Within 45 to 60 minutes of waking, fuel your body with a balanced, low-sodium breakfast. Skipping breakfast keeps cortisol high and constricts arteries. Eating a meal signals safety to your nervous system. Choose foods rich in potassium, fiber, and protein, like oats with banana and nuts, or eggs with spinach and whole grain toast. These stabilize blood sugar, reduce sodium's effect, and sustain energy. Doctor's tip: if you're not hungry early, start with a smoothie or yogurt. Even a small meal is enough to tell your body it can relax. Step 4. Delay your coffee. Coffee is fine in moderation, but timing is everything. Drinking caffeine immediately after waking doubles your cortisol surge and can cause a temporary blood pressure spike. Instead, wait 30 to 45 minutes after breakfast. By then, your body is hydrated, nourished, and stable enough to handle caffeine's stimulating effect. Doctor's tip: have a glass of water before coffee to minimize dehydration, and choose lighter roasts or half-calf blends if you're sensitive. Step 5. Stay calm and present. Before diving into emails, news, or social media, pause for 1 minute of calm. Sit quietly, breathe slowly, and focus on something positive, like gratitude, nature sounds, or a prayer. This small ritual lowers adrenaline, balances heart rhythm, and sets a peaceful tone for your day. It's a powerful form of emotional conditioning for your cardiovascular system. Doctor's tip: even 1 minute of intentional calm reduces stress hormone release and lowers average daily blood pressure readings. Doctor Insight: this 5-step sequence supports all 3 systems that control blood pressure. Nervous system, through deep breathing and calm routines. Circulatory system, through hydration and gentle movement. Hormonal system, through balanced nutrition and delayed caffeine. Practice daily, this routine strengthens the heart's rhythm, improves vascular flexibility, and lowers your long-term risk of hypertension and heart disease. Your morning is medicine. Start slow, hydrate early, move gently, eat wisely, and center your mind. And your heart will thank you not just today, but for decades to come. Conclusion: every heartbeat in the morning sets the tone for your day and your future heart health. The habits we often overlook after waking, skipping breakfast, rushing, relying on coffee, or ignoring hydration, can quietly raise our blood pressure long before stress or work even begin. But here's the empowering truth: you can reverse it. By drinking water early, moving gently, eating smart, keeping salt low, and managing your stress, you help your heart ease into the day instead of fighting against it. These small choices protect your arteries, reduce pressure surges, and give your cardiovascular system the calm rhythm it deserves. No matter your age or history, your body is capable of balance. Every calm breath, every mindful choice, every glass of water is a step toward a stronger heart and longer life. Your morning is not just routine, it's medicine. Disclaimer: this video is for educational purposes only and not a substitute for professional medical advice. Like to spread awareness. Subscribe for more doctor-approved heart health videos. Share this to help someone you love. Thanks for watching.